Welcome to this episode of our Molecules to Medicine series, where we explore how metabolomics has been applied across the drug development pipeline. Today, we'll focus on safety and toxicity, one of the most critical bottlenecks in translating therapies into real-world treatments. Safety failures not only affect patients, but they're also among the most costly reasons for drug attrition. A late-stage toxicity signal can set back years of investment and close the door on otherwise promising therapies. That's why timing is also very important. Detecting safety risks early can save resources, reduce patient burden, and ultimately accelerate the path to safe and effective medicines. In this episode, we'll see how metabolomics offers a powerful way to provide that timely warning. Our focus will be on CAR T-cell therapy, a groundbreaking modality that has reshaped cancer care. Despite its success, CAR T is often constrained by acute, sometimes life-threatening toxicities. So the question here is, can metabolomics help us predict and ultimately prevent these adverse effects? As we mentioned, CAR T-cell therapy is a highly effective treatment for cancers like B-cell lymphoma, but its widespread use is currently limited due to inflammatory toxicity such as cytokine release syndrome and immune effector cell-associated neurotoxicity syndrome. There's therefore a great need for insights as to the mechanisms behind this, and importantly, a need for tools for early risk assessment and patient stratification in order to enable timely preventative measures. Metabolites serve as very acute indicators of change within the body. Any shift from a healthy state to a disease state or response to a drug or intervention requires changes in biochemistry, in which metabolomics is positioned to capture it in great detail and accuracy. So in this study, the investigators assessed whether the metabolome itself can act as an early warning system, also revealing which patients are at highest risk of toxicity. In this case, plasma samples were collected prior to CAR T infusion and were analyzed using Metabolome's Global Discovery Panel to determine whether patients who later developed severe CRS or ICANS looked metabolically different at baseline. As with any immunotherapy, immune activation is essential for tumor clearance, but excessive or dysregulated response drives toxicity. And this delicate balance is already visible in the metabolome before treatment begins. Metabolomic profiling of baseline plasma samples here identified over 1,000 metabolites, with biochemical signatures distinguishing patients at risk. Two findings stood out. First, metabolite patterns predicted the severity of toxicity, so who was more likely to develop high-grade CRS or ICANS. And second, they predicted the timing of onset, so whether toxicity appeared early or later in the course of treatment. So this dual predictive power means that the metabolome not only signals risk, but also informs the window in which clinicians should monitor patients more closely. When we break down the metabolite signals by pathway, several important themes emerge. Carbohydrate metabolites, including glucose and mannose, were enriched in patients who developed early and severe CRS, and this substrates fuel glycolysis and T-cell activation, essentially priming the immune system for an exaggerated inflammatory response. In contrast, amino acids such as glycine, glutamine, and proline were more abundant in patients with lower grade toxicities. These metabolites feed into protective pathways, so supporting glutathione-dependent antioxidant defenses, maintaining endothelial stability, and buffering against oxidative stress. So when these reserves are depleted, the host's capacity to regulate inflammation is compromised, increasing susceptibility to severe CRS and ICANS. Lipids formed is the third major signal. So elevated cholesterol and sphingolipid metabolites were closely associated with both the severity as well as the earlier onset of CRS and ICANS. These pathways are mechanistically linked to cytokine signaling, disruption of the blood-brain barrier, and amplification of systemic inflammation. So together, these findings highlight that toxicity is not random. The baseline metabolome captures each patient's underlying immunometabolic state to pick the balance towards resilience or susceptibility before therapy even begins. So if baseline metabolomics can identify who is at higher risk, it opens the door to screening assays that stratify patients before CAR T therapy, for example. This could guide pre-treatment decisions, such as closer monitoring and preventative interventions, to tailoring regimens based on metabolic risk. By capturing host biology at the metabolite level, we not only predict who is vulnerable, but also when toxicity is more likely to occur. This insight support smarter trial design, more effective patient stratification, and ultimately safer delivery of treatments. And in the longer term, it raises a possibility of metabolite-guided interventions that reduce toxicities altogether, improving both patient outcomes and their clinical reach. This case study illustrates the broader value of metabolomics in drug development, transforming safety and toxicity from a hard-to-predict bottleneck into a measurable and manageable parameter. And as you'll see across this series, that shift has the potential to change how we bring therapies forward. In our next episodes, we'll continue exploring how metabolomics brings impact and precision to different phases of drug development. Thank you for joining us.